psychiatric departments at leading hospitals in Mumbai. A former president of the Bombay Psychiatric Society, Dr. Matcheswalla, is also the founder chairman of Dilasa Self Help Group, charitable trust, and humanity health organization working to support mental health and addiction recovery in underserved communities. I would like to add that I have known Dr. Matcheswalla for almost 3 decades now, right from consulting with him personally and also doing a lot of social activities in the field of mental health. And sir has always been very open hearted and very what do you say, he's been very uh, supportive of any psychosocial interventions to help the people who are suffering from mental illness. We welcome you, Dr. Macheswalla. Dr. Macheswalla is also joined by Dr. Kiran Makhijani. Let me introduce her also. Kiran Makhijani is a certified psychologist based in Mumbai, working with Dr. Yusuf Macheswalla with over 9 years of experience in psychotherapy, counseling, and clinical assessments. She holds an MA and MSc in clinical psychology, along with a postgraduate diploma in medico legal systems. That's very important today as per the Mental Health Act. Her expertise spans psychotherapy, counseling, clinical and behavioral assessments, as well as evidence based interventions. Passionate about advancing universal mental health, she's deeply committed to creating awareness, offering support, and fostering emotional well being with a special interest in working with children. She strongly believes in early intervention. She strongly believes in early intervention and addressing challenges at the onset to build healthier futures. I had the occasion of, being, I had the, happy occasion of working with Dr. Kiran Makhijani for a ramp walk for mental health, which was very well received and created a lot of awareness. And there I saw her enthusiasm and her interest. And she's also a book writer. She's written a book about various cases in psychiatry. So over to you. Before we start, I would like to ask a few questions. uh, Dr. Machiswala, I believe that, drug addiction in India, we heard about it last when we talked about Punjab, the state of Punjab, which was full of a whole generation of youth were ruined, their lives were ruined due to drug addiction. And now I'm also hearing about it in a city like Mumbai. How far do you think, sir, is this fight against drug addiction, and why are we not able to bring it under control? Dr. Machiswala, over to you.
Erasing, even the liquid which is used in lighter. So those things were happening. So people had quite forgotten alcohol. Alcohol has been there for ages and it is still there. But these drugs, alcohol, somehow it never problems. But these drugs, had a negative impact. I mean, related, crime related. So, like, and it used to be so addictive that if the boy did not get his dose, he would go into severe problems. Within 24 hours, the withdrawal will start and would want to have his fix anyhow or the other. Whether he would do it on a panni or whether he would take IV injections. Like for alcohol, it takes about 3 days, to go into severe withdrawal. That also if he's day and night alcoholic, chronic alcoholics. So this kind of a problem we were facing, and we really didn't know. We didn't have proper training to how to take care of these people, how to treat them. Then, of course, Father Joe Pereira and Dr. Joshi, Vasant Joshi, our head of the department, who himself was an addict before, and he had, with the help of Alcoholic Anonymous, Narcotic Anonymous, he had come out of all those problems. But over the period of years, we psychiatrists have also now become well versed on how to handle these particular problems. But the more we are treating, the more newer and newer are coming in. Called MD, mephedrone, which otherwise is a chemical, which can be made
Yes.
in the house also. And it would be used in certain medical disorders also. So that has become the in thing. Now, I mean, like brown sugar and all has come down a little bit, because the 85, 80s was when Rajiv Gandhi brought in a lot of changes in our country. So that time all these came from outside, and from the triangle, and all these places. And now more and more youngsters and other age also, they have got to uh, had a it also, and some it is very, and many people are taking IV injection. A lot of them become positive, as well as they are also becoming absolutely anti-positive. Liver also gets damaged. Uh, and very, these people, they cannot predicted. We can give it up. For months we can give it up and we not need it. After 2 3 months again, अच्छा माल आया है. They would rent a bungalow around Mumbai, and they would keep about 30 40 people over there. So it had become a kind of a business. Hmm? There are few NGOs who are really kind of, seriously involved in the treatment. There is Jagruti Foundation, or in Pune there is Chaitanya Foundation, who have been doing really very good work in helping out in treating these drug addicts. But Punjab, to chalo theek hai, because suddenly a lot of money came over there, money from USA and Canada. So lots of youngsters got addicted over there. There was really ready money. Then the Northeast is, fully, it's a full of drug addict menace. And lots of youngsters, now they are kind of developing tuberculosis. They are going towards crime. Now to get their drugs, they have to have money. And lots of people themselves, the drug addicts with themselves become peddlers, because these drug sellers, they tell them, okay, you get 5 clients, your drug will be free. So this is how the cycle goes. And we all, the people who are involved in the treatment, not just psychiatrists, but lots of NGOs and lots of social workers who are involved in rehabilitating these youngsters, are working hard towards getting them back into. It's a big job to get them back into mainstream. But even if 1 out of 10, if we are able to help them come back to normal life, it's a good thing. Yeah, and as I told you, okay, lots of crime, lots of people have killed their own family members to get money for drugs. I remember one
Oh my
person.
God.
I remember one young man. He asked his mother for money for drugs. The mother refused, and he tried to pull her Mangal Sutra. In that pulling, the mother kind of fell off the some fifth, sixth floor. She died. So these kind of problems are also happening
I just
over.
want to ask one question. If you a person with drug addiction comes to you all for treatment, like you were saying that in alcohol, it takes 3 days for the withdrawal symptoms. For drugs, how much time does it take for actually to get out of the drug system, withdrawal, and then again get back to normal? Does it take 6 to 8 months, or how does it work? How are the medications? Are they very efficient?
The withdrawal period I told of alcohol, but their treatment, I mean, to become get into sobriety is a long time. Like
Yeah,
it takes about 100 days.
100 days.
Alcoholic Anonymous advises that, at least 100 meetings every day you attend. So now these other, depending upon different drugs, like if you say charas, ganja, they cannabis and all that. Usually the withdrawals are not much physical withdrawals.
Mhm.
But only thing is, when the time is up, then there is a ganti in the head. It's, now we should go out, meet our friends, have a couple of puffs, and chill out. So
Mm.
if these kinds of charas ganja, if they don't get for a few days also, there's no real physical withdrawal symptoms. Yeah, mentally they feel, kind of a little low, down, depressed, and only when they take it, they feel better. Same thing is about MDs, mephedron and all.
Yeah.
Yeah, like when they start, they go on a binge for 3, 4, 5 days. They'll continuously have it till they are absolutely exhausted. Then they will stop it. And when they'll stop it, they'll go down. I mean, MD and all, gives you a big high. Like people take MD to have to go so that they can dance the whole night in a pub, or people
Mm.
use it to enhance their sexual activity so that they
Right.
can have sexual intercourse for a long time. So after some time, then they get fed up, then they leave it. They do,
Mm.
and that few days they go very down. Then they are absolutely nidhal. uh, they are kind of with no energy left. 3, 4 days they will go to work, they may not go to work. And after a few days again they become all right. They'll say कि भाई अभी नहीं लेना है, अभी कभी भी नहीं लेना है. Few months they may not take it at all, but one fine day they may meet their friends
Send
or
and get it again.
who phones them and says कि best mal has come. You
Acha.
must try this mal. And when the moment he sees that weed, the MD, and
Mm.
all excitement comes, and then he takes it. So drugs and all is there everywhere. Ah, the only thing is on different places it is different. Like in Gujarat, because there is it's a
Prohibition.
prohibited city state. So there a lot of alcoholism is there. Lot of
Mm.
people having gutka is there. Huh? Tobacco, smokeless tobacco, and
Mhm.
like Mumbai to is a capital, I would say. Lots of suicides are happening. Lots of suicides people do, when they don't get it and kind of, uh, they blackmail their family. If you don't give me, I'll jump. Now, in the
Mm.
last few years, now there are different addictions. Now, what we call it as mobile addiction, screen
Oh, yeah.
addiction. So now more and more youngsters are getting addicted to social medias, and the high that they get, the dopamine high, is very
Mm.
similar to what high they get with other drugs. So
Okay.
this is what is happening. So now more and more youngsters are getting involved with social medias, and they may continue it for whole night. Then their sleep gets affected, and if they are stalked by their parents, so they become violent.
They become one.
So I have
Here, I
treated
want to
lots of.
ask you, I read in the newspaper that Australia has banned mobiles for children in schools till the age of
Yeah,
15. I read it in the
yeah,
papers.
yeah.
Here also, how can we help our children not to get into these addictions? Can we should we, I mean, can we actually ban social media? Or, I mean, what can be done in India with the schools? Are people going to the schools and telling the students not to go for drug addiction?
See, now we social media is, also required. It gives you a lot of information and knowledge, and it keeps you up to date.
Right.
But it's addiction means, when the person can't do without it. He spends 10 hours, 12 hours of the day. He's not able to function. He's not able to do his day-to-day work. His sleeps gets affected. His health get affected. He doesn't even remember to eat food. He's not able to concentrate in his studies. He's not able to go to work properly and do his work properly over there.
Hmm.
So in these kinds of situations, uh, there's a lot of depletion of the chemicals in our brain. There's so much of chemical is been spent off. So the positive chemical that we need, serotonin, acetylcholine,
Fine.
so they go when these people kind of, a lot of health issues happen. And many times, when the parents try to curfew, take
Hmm.
away the mobiles,
Hmm.
take it from the child becomes so violent, so
Hmm.
aggressive. He may break things. He may even be violent on the family parents. He may kind of threaten to jump. He
Hmm.
would go on a bhook hartal, and all
Hmm.
those things also they do. And then sometimes the family are helpless and they have to give back the mobile. But yes, there are treatments available for this. There are counseling, there are cognitive behavior therapy, there are rational emotive therapy, and there are medications also to help kids come out of these addictions also, the screen addiction. So it helps with treatment. It can help and to come out of this. So on one side, there are the peddlers. On one side, there are
Hmm.
these attractive social networking sites, which which kind of addicts you. You just can't do without it.
Hmm.
Then there are all these online games, online gamblings,
Hmm.
online where people get hooked to it, and they are not able to kind of leave it. They are not able to sleep. They want to play, play, and play. Hmm? And obviously, their health gets affected, their career gets affected. Now, these days, currently, what I see is, some parents come, they have small baby, 6 months old, 8 months old. The moment the baby cries, the mother gives the mobile phone in the hand of the baby, and
Oh, yes. Yeah.
the baby knows how to open up and see which. I mean, I don't know what they see. Sometimes it is
The
that,
colors, bright colors from the screen might be
in
attractive.
6 to 8 months. Some years back, in a similar situation, mother has come with the child. The child suddenly starts howling. Mother is having gutka in her mouth.
Oh
The
my
mother
God.
removes a little bit of gutka and puts it in the mouth of
Yeah.
the baby, and the baby becomes smiling.
Smelling.
Huh?
Yeah.
Correct.
This we used to read
That is
about these caretakers and ayahs and all. They used to give this thing to make the child sleep so that
mm,
they can relax and not do their work actually.
true,
Yeah.
true. So basically, parental responsibility is there, which has to start right from the beginning, from the child. The moment the child is born,
Mm.
the responsibility happens. Just seeing that they are growing well, their development is happening properly, they are healthy, they are getting their vaccinations. But also one has to start with activities, physical activities. Now there
Yeah.
are
Physical
for
activities. Yeah.
6 months old kids also there are play schools, where those kinds of activities are
Are being
trained
done.
for the kids, by which they are able to kind of develop their neuro development system. Their
Yes.
neurons develop far better and faster. So
Yeah.
these things are happening. right from 6 months old. So that child is not getting used more on the screen, but the child is able to have outdoor games, creative
Right.
games, mental games, hmm, which will help him
So,
to improve his intellectual capacity as well as in future stay away from addictive stuff.
so
Addictive
we
stuff.
have a question from one of our participants. They want to know how effective is the rehabilitation centers present, particularly in Mumbai? Because how many are there, and where is the availability? Is it only public sector, or is there some private sector also organizations which do this rehab? Are there
See,
many in
now
Mumbai now?
in the last few years, rehabs have mushroomed. You leave
Oh.
Mumbai, go outside Mumbai, say Vasai Virar, Kalyan, Karjat, and all that. So, as I told you, the ex-addicts, they made a business out of it. They are unlicensed.
Hmm.
They rent a bungalow, which they pay 25, 30,000. And they put about 30, 40 people inside. And that's cheap because there are lots of people are not able to afford authentic rehabs.
Right.
Authentic rehabs are those rehabs which are licensed by the government of Maharashtra, huh,
Hmm.
which has a full-fledged team, a team comprising of psychiatrists, psychologists, counselor, physiotherapist, occupational therapist, yoga therapist, and where each case is worked both, psychologically, sociologically, biologically, and those kind of places are there where the rates are also a little on the higher side, but there the work is done well. Scientifically, it is done, and the rehab program does work over there. Like, for example, I send my patients to a Jagruti Rehab Center,
Hmm.
which has got all over the country. They have just as Kripa Foundation is also
Yes.
there all over the country. That is also an authentic rehab center. Now a lot of five-star rehabs have come up, where
Right.
the monthly charge will be about 5 lakh rupees. To
Hmm.
name a few, there is Samarpan. Then in near Baroda, there is one Alpha Healing. In
Okay.
Coimbatore, there is one center. There are also spiritual rehab centers also, where
Spiritual.
along with the regular scientific treatment, there's a lot of spiritual activities also involved, which
Hmm.
also helps. Hmm? Uh, People may not like it, but I use a lot of ECT, electroconvulsive therapy, in my patients of drug addiction because I believe that most of the drug addiction cases have underlying depression, underlying bipolar mood disorder,
Right.
underlying OCD, where medication and electroconvulsive therapy or transcranial magnetic therapy or some
Yes.
brain polarizer and these kinds of things are also helpful. So my
So
patient, whenever I
have you found using these methods the outcome, what we say, has been better than the
definitely
otherwise?
my results are very good. At least I would say 80%, where I admit them for a few days. I start with ECTs and the other lines of treatment. Everybody has their own role to play. We have a counselor, psychologist, uh, therapist, occupational therapist, me as a psychiatrist. And I've been doing this ECT for quite some time. And the family also feels that yes, after ECT, stabilization has come more.
Stabilization.
Motivation has improved. Otherwise, just keeping somebody against his wish in a rehab, keeping him for 6 months and he comes back, and the next day only he starts because that the motivation was not worked on. The kind of the power to
Self
give up
control.
give up the drugs was not there. But by giving
Yes.
these kind of treatments, they are able to, kind of, they are able to have a motivation. They are able to take the right decision also. and positive chemicals are made in by the DCT and TMS,
Mm.
and even IV ketamine helps to some extent. So ketamine itself could be an addictive drug.
Here, I want to just, talk about, there was a huge drama a year and a half back with this Shah Rukh Khan's son, Aryan, I forgot his name, Aryan Khan. They was on some ship and some drugs were found and all that. And that was made into a very big media kind of thing. Do you think that helps or it's not good actually to have so much of media hype?
The thing is, obviously, it was Shah Rukh Khan's son. So media is
Yes,
going to be I mean, they are celebrities, no? So
yes.
media focused on Aryan Khan. There were many people over there. They were going for a outing.
Mm.
It's like a rave party,
Yeah,
where
very
they carry with them their drugs. Individual carries whatever they are interested in. Huh? So apart from all these, there are hallucinogenic drugs which I have not mentioned. Huh?
mm.
There are psilocybin, there are magic mushrooms, huh?
Mm.
And
That sounds
so
interesting. Magic
there were
mushroom.
other people, those other people were not under, kind of media glare. This
Mutiny.
was
Yeah, they were not on.
Khan, number one, the King Khan.
Yeah.
King Khan. So it was like, it was for the media also, it was Chandi, and
Mm.
the guy who did the work and all that was Sona.
Investigation. Yeah.
Mm. Mhm.
Here
So
I
that
want
is
to
why.
ask you. Yeah. Here I want to ask you that suppose I or someone in my family we discover that they have a drug addiction. Till that time, we are not knowing they are going out with their friends, they are getting addiction. But sometimes you start seeing that the money is getting used up, or the child is asking for more pocket money, or somehow you come to know that they are not in the good, their peer group is not the good type of peer group, and you think that it has started. Then what should the family member do? They can't just pick him up and take to the doctor. What should be done? Today I came to know that
What
my
happens,
brother
no,
is
what
having.
happens is parents have faith in their children.
Yes.
They always feel कि मेरा बच्चा सबसे अच्छा,
Ah.
मेरा बच्चा ये कर ही नहीं सकता. क्योंकि
Hmm.
कहावत है ना कि बच्चा कैसा भी काला कूला हो, द
कौवे
पेरेंट्स
का
विल लव.
बच्चा.
और
हाँ.
बीवी कितनी भी खूबसूरत हो, उनको दूसरे की बीवी पसंद आती थी. तो
ये
ऐसे
बात.
कहावत है. तो इनिशियली तो वी आर विल नॉट विलिंग टू डिनायल रहता है पेरेंट्स को कि हमारा बच्चा कहीं गलत रास्ते पे जा रहा है. समटाइम दे फाइंड थिंग्स आल्सो इन हिज बैग, तो दे
Hmm.
आस्क हिम क्या है. तो दैट फेलो से ये मेरे एक दोस्त का है, उसने मुझे रखने को दिया है. आई एम जस्ट
Yeah.
टीचिंग. एंड पेरेंट्स अग्री, पेरेंट्स बिलीव देयर चिल्ड्रन, मोस्ट ऑफ द पेरेंट्स. Till like when other families, other parents inform them also, if I had seen your kid doing something like that, then also they will not, they will believe the son. The son will say, नहीं नहीं, मैं तो खाली बैठा था, वो लोग कर रहे थे, वो लोग क्या कर रहे थे मुझे नहीं मालूम. I was just sitting. फिर सिगरेट की बात नहीं, I was just smoking simple cigarette. मैं कुछ ड्रग वग नहीं लेता हूँ. Till some major catastrophe happens, still there is a major complaint from the school or college कि भाई your child is being rusticated or suspended. Huh? And till then also, the mother is not willing to accept. Mother डॉक्टर के पास लेके जाने को तैयार नहीं है. वो बहुत यानी बच्चे को और पंपोलेगी और प्यार करेगी, मेरा बच्चा प्लीज ये सब जब पता चलता है, ये सब छोड़ दो बेटा, तुम्हेरी कसम, तुम्हें मेरा मरा हुआ चेहरा देखोगे अगर तुम ये करते रहोगे. द बॉय विल प्लेस हिज हैंड ऑन द गीता और से कि हाँ मैं नहीं करूंगा. बट ऑल दैट डजंट वर्क. इवेंचुअली व्हेन सर के ऊपर पानी आ जाता है, तो देन शी then the mother to nahi, but then the father and other family members,
Relatives.
Kaka and all that, who take the initiative कि भाई अभी इसका क्या करना. So then they discuss among themselves, they go on the net, they talk to their family physician, and then they are mentioned कि भाई he has to be taken to a psychiatrist or to a center. Like we have the Samarpan, they have their very
Yes.
good OPD system also, huh? Consulting and all that. And my Balaji hospital or Masina hospital.
Mm.
Then they are brought. And when they are brought also, and after detailed history, everything, and when the moment I say that he requires to be admitted, so there's
Mm.
a big hue and cry. नहीं 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 नहीं
Mm.
मेरे बच्चा इतना कोई खराब नहीं है कि उसको एडमिट करना पड़े.
Mm.
मेरा बच्चा तो आप कुछ दवाई ववाई दे दो उससे वो ठीक हो जाएगा. मैं स्ट्रिक्टली मैं उसको 24 घंटा मेरी नजर में रखूंगी और
Mm.
मैं उसको नहीं जाने दूंगी इधर उधर. So this is how it is initially,
Mm.
but that also doesn't work. Finally, बोलता है ना कि एकदम end stage में they agree. Because anything, if you nip it in the bud, you get the best results. Whether it is cancer, stage 1 of cancer, you get very good result. Whether it is schizophrenia, when you pick it up in the early stage, in adolescent phase में schizophrenia आता है, and you start
Mm.
treating from that time, you get very good results. Anything, you delay and you do it, so the results are not so good. I've come across so many of these people who have killed their parent also for
My
drugs.
God.
I mean, so
And
many,
quite
and
devastating. Yeah.
that also, many times it is covered up.
Yeah.
हाँ, so ये
Naturally.
सब होता है. So people are coming to the doctors quite late because parents are not. Huh? Sometimes when the school or the college picks it up, and then
Yes.
when they force the family,
Yes.
either get his treatment done, or sorry, he will be rusticated from our college. Then the family, kind of takes the step. There are some family, some parents who are understanding enough to realize soon that the problem is there, and they take whatever best possible advice they get and best possible treatment affordable to them. Hmm? Then they do that. And sometimes maybe one cycle of rehab may not work, maybe 2 or 3 or 4 cycles. But always I found it Alcoholic Anonymous and Narcotic Anonymous plays a very important role in this.
Okay.
And the when there is a person, they say no, kind of a sibling who
Yes.
supports the next addict and he supports the person. He's with him throughout the day and night, and he kind of motivates him well enough. So there it works. Now, where most of this, you had asked some time back, most of these centers are private centers. There are
Private.
very few government centers, like all government municipal hospitals, are
Okay.
supposed to be have de-addiction beds. De-addiction, not rehab.
Yeah, I got it.
So, like in GT Hospital, St. George Hospital, KEM
Yeah.
Hospital, and the BMC has a Bardawadi Hospital in Andheri.
Mm.
So, these are the government run hospitals. The Thana Mental Hospital also has a department for
For drug addiction.
drug addictions, where they also do some rehabs. So, government definitely is doing its role, but the problem is far too severe for the
Yes.
government alone to handle it.
Mm.
Government is bringing out best of laws and rules, how to see that the supply is reduced. And
That's good. What about the police in Mumbai? How do you find the police?
there is Narcotic Control Bureau, central government, There is
NCB,
an
yeah.
narcotic cell of the Mumbai police. Now there are black sheep in every field. There are some people who are really kind of they do the work very, very
Mm.
seriously.
Mm.
There are some where they are hand to hand. Like there
Yeah.
was a famous case of Baby Patankar, who was
Mm.
a drug peddler,
Right.
and she had a lot of police guys in her hands, and she would really give them good money and yes, to
Oh,
support her.
yeah. So she was basically paying them hush money to just keep quiet and not act on the people.
But all
But
police are not like that. There are some people.
mm,
But you know, see now this on the top level,
yeah,
the drug business has become a narco terrorism business.
narco terrorism. Okay, what do you mean by that?
See now, basically, if you go to see the from Afghanistan, Pakistan, hmm,
Hmm.
so
Okay,
where where these drugs are produced, manufactured,
right. Afghanistan is where
they are
it's the maximum.
stolen. They are stolen to buy arms, firearms,
Mhm.
and
Okay,
AK-47 and all that.
right.
They are used for waging war against a nation
Okay.
or terrorist activities. Hmm. So it's become a narco-terrorism business. In Madhya Pradesh, uh, there are official uh, fields, farms of poppy. Hmm.
Okay,
That
is
is
that legal?
Afim.
Is that
Afim,
legal,
Afim.
Poppy? Afim,
Ah,
huh?
ah,
It's not legal,
they are
no?
licensed.
What's it?
Ah, they are licensed.
They're
Because
licensed.
see,
Oh.
many medications are also made by these Afims.
Hmm.
From many medications are also made. So, and they have to sell it to the government only. Huh? And those people are very, kind of very rich people. Those people who are making, uh, growing a film and all that. They are like simple farmers, but they are very rich people. So, but they are supposed to sell it. But lot of it goes to the black market also.
Yeah.
But
Yeah,
they
I
are
mean, it
supposed to.
has its uses in pain killing and in cancer and also the pain patches
Yeah.
and all. You
Yes,
do
yes.
use it, but they are diverting that to the
Hmm.
narco terrorism, I suppose.
Some part is diverted.
Yes,
This
yes.
is another area where uh, these things are grown officially. Of
Hmm.
course, just now among the youngsters, apart from MD, the weed, marijuana, it's become the in thing, and there is a big lobby which which is fighting for the rights of marijuana to make it legalized in our country. They are kind of giving examples of various countries where it is legalized, where it is medical marijuana. Hmm.
Yes,
And
people saying that cannabis is legal in America and weed is legal in
some states in
Canada and all
America.
that.
Yeah,
And they
so
are
but they are medical marijuana. Now, in our
okay.
country also, Sun Pharmaceutical has come out with medical marijuana. Huh?
Okay.
But that
What is
that
that?
is
Medical marijuana is what I didn't understand.
is used for certain conditions like pediatric epilepsy, uh,
Hmm.
uh, autism, and many such conditions it has been used as a
Hmm.
medication. And they
Right.
say that mephedrone, all this will also come someday as a medicine.
Oh, okay.
So once upon a time, Mandrax was a sleeping tablet and it was an official drug. But more and more people had got so addicted to it that the government eventually had to ban it. So about 20 years back, it got banned.
Yeah,
Then
I
we
heard
have
about Madrex many years ago, but now it's no longer there.
no, but now it is India is the number one manufacturer of Mandrax. and their
Oh,
main country is Africa.
oh, okay.
It goes to Africa. यहाँ नहीं मिलता है. It's very difficult to get it.
Mhm.
Yeah. So Mandrex is there. Once upon a time, morphine and all still used in cancer hospitals and all that. But there was one injection, Fortwin, pentazocine, which was a derivative of morphine heroin,
Hmm.
heroin derivative. But it was used more as an addictive drug than
Okay.
because 14 Finargan, to it was surgeons used it like left, right, and center.
Yeah,
Like
Phenergam was given to children to sleep.
Finargan is still available, and it is like syrup is also the injection.
Yeah,
This
yeah,
14 Finargan combination to give mild anesthesia for minor operations. But
yeah.
lots of people got so addicted to Fortwin, मतलब IV, IM. I've had people who have got, abscesses all over their body, and they are totally on a kind of, they cannot do without Fortwin. So now Fortwin is not available.
Okay.
Available only in, certain hospitals. Okay.
Thanks a lot. Before we wind up, is there anybody else who has any more questions? There's a question, sir. Are there any spiritual rehabs in Mumbai? There's a question.
See, spiritual rehabs, in Mumbai, like some people go for 10 days for the Vipassana.
Yeah,
But Vipassana people say first get yourself detox, then you come. Okay.
after the
Then,
detox.
then there are many which I may not know, many ashrams in and around
Okay.
Mumbai. But this thing, art of inner engineering, Sadhguru in
Sadhguru.
Coimbatore. So that is there. Which one?
Yeah.
Art of Living. Art of
Art
Living
of
is
living.
the Art of Living is different. That is in Bangalore.
Yeah.
That is Sri
In
Sri
Mumbai,
Ravi.
it is not there. Yeah.
So there also people go there and get themselves detox. Then there are nature cure centers.
Nature Cure
One
Center.
is there, Lonavala. So lots of people like to go to these nature cure centers for a detox.
Right.
Something called now digital detox.
Ah,
People
no
getting
phone.
addicted to digital. So
Yeah.
that
Yeah.
also is there. Hmm?
Yeah.
And in Bangalore, there is one Jindal Health Farm.
Jindal Farms. Jindal Farms.
Jindal Farm,
That's also
where
well to do.
also they do all kinds of different treatments for different disorders. Hmm?
Yes.
So, and there are many, like Neral, there is centers. Lots
Yeah.
of people need
Right.
it. Huh? So,
So that was wonderful hearing from you, Dr. Matcheswalla. I really want to thank you and Dr. Kiran Makijani for joining us today on this important
you
topic
all
of
would
drug
like to ask
addiction.
Kiran anything?
Yeah, Kiran,
Kiran,
would you like to give your to speak a few words or on drug addiction, your exposure, and anything you would like to share? We'll be happy to hear from you.
I'll just like to add that this once we realize that there are those red flags, a lot of people shy away because of the stigma. And like Sir
Mhm.
said, parents, families don't really accept it. But I think that's where we should be focusing on and work towards getting the right help. The faster you get it, and it really works rather than pushing it right till the top. So that's something that really matters.
Thank you, Dr. Kiran. Uh, I would now request Dr. Sachin Ganorkar to give the vote of thanks to the whole team. Over to you, Dr. Sachin.
Yes, ma'am. Akila, ma'am, thank you very much. Thank you, Dr. Macheswalla and Kiran. It was a pleasure listening to you. You have been a doyen in this field for many years. So it was really a privilege to actually listen to you and your entire vast amount of experience. First, I just wanted to thank Akila, madam. She has been a schizophrenia warrior, a trailblazer, and a founder of NAMI India. So we express our gratitude for organizing this event with FAVMI and Saraswati. Diagnosed in her early years, Akila ma'am has not only combated the disease, but also the challenges of mental health to lead a life of purpose as a wife, mother, and an independent individual. And also as an advocate committed to systemic change in the mental health field. So thank you very much. On the behalf of everybody here, on the behalf of the organizing committee, NAMI India and FAMI, it's a privilege to deliver the vote of thanks. So our heartfelt thanks to all the people who were actually the panelists who came and attended the session and shared their views. Thanking the additional director for mental health for coming over and giving the inaugural address. Thanking Akila ma'am and Saraswati for putting in all the effort, Yogesh, and all the team. I think all the team at the back end who has put in the effort to record the session, get the images done. I think all the entire coordination which you have done and the hard work and the sweat which you have done behind to get this in shape and get it running. I think a gratitude to you. I think whatever we heard today about ADHD and bipolar disorder and the media portrayal in mental health and now drug addiction, I think there's some amount of information which we'll carry. So we won't remember everything. But I think all of us as advocates should at least start talking to this in our community. See that if you see a person with any of these symptoms of what we have discussed today, they should at least go to a place where evidence-based medicine is practiced and they should be able to seek help. I just wanted to thank you for people who have spent the entire day with us. It's a Sunday, but you who have hung in and who have given their time to actually be present online and have been there with us. And a special thanks to Akila ma'am, who has a lived experience, Saraswati, and all the families who and Suresh sir. And there are other people like I can see Mr. Bajrang Lal, who have a lived experience and who want to bring a change in what is happening today in our society. So thank you very much. Our deep gratitude to all those people, and also not to those people who we have not mentioned as a vote of thanks, but everybody here who has been in the front end and the back end to manage this entire conference. Thank you very much.
Also, a big thank you to Sachin Ganokar for supporting us completely.
Yes.